In mid-January, a tour group from China landed in Singapore and took in all the sights: the harbor, the famous Marina Bay Hotel, and they stopped at the little-known Yong Tai Hang Chinese medicine shop. After they left, the shopkeeper came down with COVID-19. Singapore's first-class public health system swung into action. To start, hospital contact tracers tracked down everyone the shopkeeper had been exposed to. Then everyone the Chinese tourists had encountered. Then everyone who had shared the same taxis used by infected people. Credit card records and security camera video were accessed. As the contact tracing job grew larger, police were brought in to help. And then the army. The coronavirus outbreak was almost shut down in its infancy. Professor Leo Yi Sin is the executive director of Singapore's National Centre for Infectious Diseases.
Well, the other good things about Singapore being very small, it is that it is completely wired up. It is all connected through the latest IT system. So it gives this advantage in terms of contact tracing.
Singapore also moved quickly to mass testing.
We test a lot, and I think because we test a lot, we tend to pick up people that are relatively in the milder phase or early phase of the clinical illness.
But it wasn't enough. In mid-February, COVID-19 found Singapore's weak spot, the so-called guest worker system. 1 million foreign workers, nearly 20% of Singapore's population, are mostly from Bangladesh and India. They slave away for very low wages, sometimes $20 a day. They live in company dormitories, often packed in 10 or 20 to a room. Up to 100 men might share a toilet. Kirsten Han is a Singapore freelance journalist.
If a migrant worker is ill, he's not going to say that he's ill because he's afraid of what happens if he takes sick leave. Because his employer might be unhappy, he might get fined for taking sick leave, he might have his work permit cancelled and be repatriated.
The first migrant worker infection was registered on February 8th. Then the virus showed up at the giant Mustafa shopping complex.
Mustafa supermarket basically cater to a lot of foreign workers. Full range of commodities, they can get anything they want, anything from their own hometown that they need. And that served as one of the amplifier among the foreign workers in Singapore.
In early April, guest workers were confined to their dorms and the economy ground to a halt.
I think with the density of the dormitories and the fact that this isn't the first disease outbreak to happen in dormitories, we've also seen measles and dengue and Zika and things like that. There should have been more attention paid to how vulnerable these communities were to an outbreak. And if you wait for the outbreak to happen before something gets done in an environment where men are living in such close quarters, then you'll always be playing catch up.
The crisis may have brought out the worst in some Singapore residents. Jia Ian Chong teaches political science at the National University of Singapore.
The infection in the migrant worker dorms, I think, is uncovering a lot of the nastiness and, frankly, racism that had been latent in Singapore society for a long time. People saying, well, these migrant workers, they're dirty by culture, they're dirty, and they have it good here in Singapore. Why are they demanding more? That they sort of deserve their lot. Those kinds of sentiments are coming out in a way that is a lot less varnished than before.
In a TV address to the nation on April 30th, Singapore's Prime Minister Lee Hsien Loong bent over backwards to express his appreciation and concern for the guest workers.
I too send my thanks and good wishes to all migrant workers in Singapore for what you have built and contributed here.
While in Parliament, the Health Minister underlined that it was in everyone's interest to come to the aid of the men in the infected dormitories.
Otherwise, we will continue to be at risk of a spillover from the dormitories into the wider population.
The government quickly built up temporary facilities to quarantine the infected guest workers. The beds kept the men 6 feet apart. Probably because workers are young and healthy, the death rate in Singapore is still very low. Some robots brought them their food and medicine. Other robots allowed them to remotely consult doctors. They seem wild for automation in Singapore. From the robot dog that leads people around in quarantine
Please practice safe distancing at all times.
to the robot security officer that cautions people to socially distance while they are exercising in the park.
Play your part in fighting COVID-19 with just 2 simple steps.
On March 21st, the government began encouraging all citizens to load a new contact tracing app called Trace Together into their cell phones. The app will keep a log on the phone of every other device that shared close contact with the owner over a 14-day period. Information that would be turned over to health authorities if the cell phone carrier became infected. So far, it's not a great success.
Since then, we've learned that a very small number of Singaporeans, about 1.1 million Singaporeans, have downloaded it, which is quite far off from the 3+ million that they actually need before it becomes effective in contact tracing.
Singapore residents may feel that in a crisis, it's okay to share your location information with health authorities, but not with the police and army, who may find other uses for it. There may be limits to technology as a solution to a pandemic. Terence McKenna, CBC News, Toronto.